Tyler Goodwin. I'm going to be performing a cardiac assessment on my patient today. So before I come into the room, I'm going to look and I'm going to compare, when I get into the room, the patient's name on the armband. I'm going to perform hand hygiene. I'm also going to provide privacy for this exam. I'm going to be taking a look at your heart and your cardiac system. So if you just follow my commands, we're going to go through a few simple steps here. Okay, so first when I come and see the patient, I'm going to inspect the general appearance of the patient. Skin color, I'm going to look at their appearance. I'm going to look, make sure that their cheeks are colored right, no discoloration. And then I'm going to inspect the extremities for color, make sure they're not cyanotic. And then I'm going to grab a hand here and I'm going to inspect the nail beds, and I'm just going to look for color. I'm going to look at the angle, make sure it's not over 160 degrees for clubbing. And I'm going to inspect the other hand as well. I'm going to assess the skin sugar on the back of the hand. I can also do it on the sternum or the forehead. I'm going to assess the capillary refill, the color and the temperature of the extremities. I'm going to do this for the upper extremities as well as the lower two. I'm going to look for edema in the lower extremities. I'm going to just take a look at her ankles, and telltale sign is a sock line here for a little bit of edema. And then I'm going to assess all of the pulses. I'm going to assess the radial and dorsalis pedis, as well as the brachial pulses. I'm going to be looking for rate, rhythm, quality, and assessing for a thrill as well. Then, after that, I'm going to check the patient's blood pressure in both arms and make sure that they're within a normal range of each other. And then I'm going to calculate the radial brachial index of the patient, and we do this by taking the upper extremity versus the lower extremity, and we compare the results for that test. And then I'm going to perform the Allen test. So I'll take the patient's radial pulse, and I'm going to occlude both arteries for a while and let the hand turn white. And then I'm going to let up on one, and I'm going to assess how long it takes for the collar and the warmth to return back to the extremity. And then I'll do the same on the other side with the other artery. I'm going to inspect the chest wall for shape, symmetry. I'm going to look for palpation or lifts and heaves, and that's in my inspection up here. And then I'm going to inspect the jugular veins. The patient will typically lay down for this procedure, and I'll have her lay back, and I'm going to look for jugular vein distension as well as pulsations. And then I'm going to palpate each carotid artery on each side one at a time when I want to occlude that off. And then I'm going to come down and I'm going to palpate the fifth intercostal space, mid-clavicular line, and I'm going to be looking for the apical pulse at the point of maximum impulse, which is there. And then I'm going to feel for the rate. I'm going to turn her on the left side and lay her down, and I'm going to feel the same. I'm going to palpate it as well. Then I'm going to come around and I'm going to palpate the carotid artery, or auscultate them with the bell of my stethoscope. And we'll do that one at a time. And I'm listening for a bruit, thrill, assessing the rate and rhythm. Sounds great. Now I'm going to auscultate the heart sounds in all 5 places. We will go right of the sternum quarter. We will go to the left and listen to all the heart valves, and we're going to assess for S1, S2 heart sounds. We'll go to the point of maximum impulse, and we're assessing for rate, rhythm, and/or extra sounds, and everything sounds great. I have my headphones in, so I can't actually listen. But these are the outline steps of the cardiac assessment on the patient. Thank you.